Hello everyone. So you see the 55-year-old male came to us with chronic back pain since 2 years and neurological claudication since 3 months. Patient had history of laminectomy L4, L5 done some 15 years back. We can see the radiology like degenerative scoliosis, loss of lordosis and adjacent segment degeneration L3, L4. So when we are planning this type of cases for intervention, we see we are going to do a revision surgery in which we have to do revision decompression, and since the deformity is there, we have to restore the coronal and sagittal balance. So there is battle of techniques when it comes to the role of minimal invasive fusion in revision lumbar spine deformity. So I present my talk on minimal invasive oblique lumbar interbody fusion for degenerative lumbar deformity correction, which is worth or not. Minimal invasive OLIF addresses all the challenges, so we aim here to study the role of MIS-OLIF to assess the clinical, radiological, and functional outcomes in degenerative lumbar spinal deformity correction. So this was a prospective observational study for a duration of 24 months. We have assessed the demographical, clinical, radiological, and functional outcomes at preoperatively and immediate post-op and followed up to 1 year. Radiological variables are assessed in terms of scoliotic angles, lumbar lordosis, PIL mismatch, and sagittal vertical axis. We have also recorded the intraoperative, perioperative, and complications. So for the final analysis, we have some 39 number of patients with a mean follow-up up to 15.8 months. The mean age was 65 years with the number of level intervened is 1 to 3 levels. The mean blood loss was 68 ml, and the hospital stay was as low as 4 days to up to 15 days, in which out of which 3 patients went to ICU for their other comorbidities. Fusion and CT scan were noted after 12 months, out of which we have seen fusion in 38 patients out of 39 patients. Complications, coming to the complications, 2 patients had Angry-Sauce syndrome that resolved spontaneously. 1 patient had superficial infection which is managed with extended antibiotics and secondary suturing, and 1 patient had venous injury which required ligation and case subsidence in 2 patients. There is improvement in VAS scores of leg pain and back pain. Similarly, the ODI score, which was clinically significant from preoperative status to followed up to 12 months. Similarly, the radiological corrections achieved, which was scoliosis, lumbar lordosis, or PIL mismatch, or sagittal vertical axis, all of them were clinically significant. The p-value is less than 0.001. So, degenerative changes in the lumbar spine leads to a complex set of deformities, as we all know. So, the multiple deformity causes a loss of sagittal and coronal alignment, leading to a mechanical compromise. Here, OLIF can be a game changer, which along with the decompression restores the disc height and provides the coronal and sagittal balancing, as we can see in the radiographs. It also advantageous since we can do a single position OLIF that reduces overall operative time and complications. This is one of the CT scan after 1 year follow-up showing the decent amount of fusion and maintenance of the alignment. Coming to the literature review, this was the paper published in 2021 in Global Spine Journal that suggests the significant, it is a meta-analysis and suggests the significant improvement in the spinopelvic parameter and concludes the OLIF is an effective and safe surgery method in the treatment of mild to moderate adjacent segment degeneration, and it has advantages in less intraoperative blood loss and lower perioperative complications. This was the paper which is a prospective comparative study between the minimal invasive OLIF and TLIF group that suggests better restoration of disc height and lumbar lordosis angles. This was the only Indian publication that's seen in the Journal of Orthopaedics in 2019, which also suggests significant improvement in the functional outcomes and the spinopelvic parameters. So I conclude my talk with suggesting that OLIF is a very effective tool to counter the issue of degenerative spinal deformity, which also provides decent correction in spinopelvic parameters and deliver good functional outcomes. But one has to be aware of the complex anatomy and the possible complications. Thank you.